Hey guys, so I want to make a video today to talk about tummy tucks. So what is a tummy tuck? Also known as an abdominoplasty. It is removing excess soft tissue that you have of the abdominal wall. So if you have extra fat and extra skin to your abdomen, then a tummy tuck is used to remove that extra tissue. So there are different versions of a tummy tuck, and I made some diagrams here. I'm a better surgeon than I'm an artist, so bear with me to kind of go over the different types of tummy tucks. So there is the mini tummy tuck, which would be an incision that kind of stays within the range of just below the belly button. That's for patients that just have a little extra pooch down, particularly below the belly button, that bothers them. And so a mini tummy tuck would be good to address that extra soft tissue. Now, you don't typically address any deeper structures. So for example, with a traditional tummy tuck, you do address your ab muscles, which I'll talk about in a second, if you have separation of the abdominal muscles. But with a mini tummy tuck, you don't address that. It's mainly just to address a little bit of extra skin and fat that you might have below the belly button. Now, a traditional abdominoplasty, there's the standard one, which goes from hip to hip. So if you feel on your hip bone, usually from hip bone to hip bone is how far that incision goes. And during that surgery, we address your ab muscles. So your ab or your six-pack muscles. Again, this is just a rough illustration. Here are your six-pack muscles. So when you are pregnant, if you're a female, your six-pack muscles stretch, they separate because of the pregnancy. And then once you deliver the baby, they don't always come back to the midline. So you might be left with this separation here between your six-pack muscles. So during an abdominoplasty, we essentially take a stitch and kind of run it down the course of the abdominal muscles to then bring them back to the midline where they're supposed to be. Tighten up that abdominal core back again to where it was before you got pregnant. And that just helps, again, to reposition the muscles where they're supposed to be. And it also gives you a little bit more of your figure back. So again, that's something that you do in a standard abdominoplasty. And also then the extended, which is the same concept, is just instead of the incisions kind of stopping from hip to hip, they go out a little bit further and sometimes even towards the back a little bit, depending on how much extra skin you have. And so again, the difference between the mini, the standard, and the extended abdominoplasty is just based on how much extra skin and soft tissue you have. Again, if you have very little tissue that needs to be addressed, then you might be able to get by with a mini abdominoplasty. If you have a little bit more soft tissue, skin and fat that needs to be addressed, and also that separation in your muscle, that can be addressed in a standard or an extended abdominoplasty. And again, if you just have a little bit more extra skin and we have to take that incision a little bit further back, then that qualifies you as needing an extended abdominoplasty. So what is the recovery like? Usually after this procedure, we want you to refrain from physical activity for about 4 to 6 weeks while you're recovering. You, again, have an incision from hip to hip. And then what I didn't mention earlier was when we remove that extra skin, we take the remaining skin and pull it down tight to make it nice and flat, but then we have to make a new hole for your belly button. So you have an incision around your belly button as well as from that hip to hip incision. So you need to take time off from physical activity to recover from that, because there's a lot of surgery, and particularly if we go in and tighten your muscles as well, a lot of healing needs to happen from that standpoint to let things scar down and strengthen before you start putting physical strain on those incisions and those repairs. So during that time period, we will also have you in a compression garment, again, to help with support, to help with managing any swelling, and also to help with shaping the body as you heal during that time period. Now, you're not bedridden, but we don't want you going out there and doing heavy exercises and really getting your heart rate up. So that's kind of the short rundown of abdominoplasty. If you guys have any other topics that you would like me to talk about, please leave them in the comments below.